Lysteda, also known as tranexamic acid, is a medication used to treat heavy bleeding during your menstrual period. It works by slowing the breakdown of blood clots, which helps to prevent prolonged bleeding. This medication belongs to a class of drugs known as antifibrinolytics. It is important to note that Lysteda is not a hormone and does not treat other menstrual or premenstrual symptoms. Additionally, it does not stop your period, is not a form of birth control, and does not protect against sexually transmitted diseases. The recommended daily dosage of Lysteda is usually 1,300 mg taken 3 times a day for up to 5 days during your menstrual period. It is best to start taking Lysteda as soon as you notice heavy bleeding, and continue taking it for the full duration as prescribed by your doctor. Always follow your doctor's instructions for the best timing and dosage for your individual needs. Before you start taking Lysteda, make sure to read the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take Lysteda by mouth with or without food as directed by your doctor, usually 3 times a day. Swallow the medication whole, do not crush or chew it. It's best to wait until your period has started before taking your first dose, and do not take Lysteda for more than 5 days in a row. The dosage of Lysteda is based on your medical condition and response to treatment. Make sure to tell your doctor if there is a change in your bleeding pattern or if heavy bleeding lasts or gets worse. If you experience nausea, vomiting, diarrhea, or muscle pain, be sure to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Most people who use this medication do not experience serious side effects. However, it's crucial to seek medical attention if you experience any of the following serious side effects: eye or eyelid problems, coughing up blood, fainting, chest/jaw/left arm pain, pain/swelling/warmth in the groin/calf, swelling/weakness/redness/pain in the arms/legs, signs of a stroke, vision changes, or symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. As always, if you have any concerns or questions about the side effects of Lysteda, be sure to consult with a healthcare professional. Before taking Lysteda, it's important to let your doctor know if you have any allergies or if you are allergic to tranexamic acid. This medication may also contain inactive ingredients that can cause allergic reactions. Make sure to discuss this with your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have a history of bleeding in the brain, blood clots, certain heart diseases, blood clotting problems, kidney problems, or irregular menstrual bleeding. Before having surgery, make sure to tell your doctor about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. Lysteda is usually used during your menstrual period and is not typically used during pregnancy. If you are pregnant, it should only be used when clearly needed, so make sure to discuss the risks and benefits with your doctor. It's also important to consult your doctor before breastfeeding, as this medication can pass into breast milk. It's important to be aware of potential drug interactions that may affect how Lysteda works or increase the risk of serious side effects. Make sure to keep a list of all the medications and products you use, including prescriptions, over-the-counter drugs, and herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Lysteda include blood thinners like warfarin and heparin, drugs that prevent bleeding, estrogens, hormonal birth control methods like pills, patches, or rings, tibolone, and tretinoin. It's also important to carefully check the labels of both prescription and over-the-counter medications, as many of them contain pain relievers and fever reducers that may increase the risk of bleeding, such as NSAIDs like aspirin, ibuprofen, and naproxen. If you have been prescribed low-dose aspirin for specific medical reasons such as heart attack or stroke prevention, it's important to continue taking it as directed by your doctor. If you have any questions about potential interactions with Lysteda, be sure to consult your doctor or pharmacist for more information. If you or someone else has taken too much Lysteda and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, contact a provincial poison control center. Symptoms of an overdose may include severe dizziness and vomiting, so it's crucial to get medical assistance as soon as possible. It is important not to share Lysteda with others. Your doctor may also require you to undergo lab or medical tests, such as kidney function or eye examinations, while taking this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Lysteda, just take it as soon as you remember. But if it's almost time for your next dose, then just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. Make sure to store Lysteda at room temperature, away from light and moisture. It's important to keep it in a place that's out of reach of children and pets. And when you no longer need it or it's expired, be sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on the best way to do this. Remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.